Hi, it's Dr. Joseph Fretta again. You've seen my after shots after I had smart lipo done to my face. This is about 3 months later. Now, after having used my growth hormone factor cream underneath my eyes, I want to add some volume to it, and I want to add some volume here. Then I'm going to do a little bit of Botox on my forehead, as you can see, and then I'm going to do a moderate chemical peel. Total time should take about an hour, and I should be able to turn the clock back by about 10 years. Okay, now the first thing we're going to do is numb my face a little bit, because I'm brave, but I'm not ridiculous. So, just going to add a little injection to the nerve tracts in this area, and I'm icing it first to have a little bit of extra numbness, and now I'm going to inject. Now what I want to do is fill in this area here and here. So with Smart Lipo I was able to tighten the face a bit, but now it's a question of replacing tissue. The medication I'm injecting is a collagen base. And it works really nice injecting superficially underneath the skin. You can see how this side is being filled in as opposed to this side right now. I think you really have to believe in yourself to inject yourself. If I were doing a patient, I wouldn't be injecting so many different areas. I'd have better control over what I'm doing because I'm looking at the patient instead of through a mirror. But okay, so now I've injected this area here, and you can see the difference in volume between this, which is kind of crepey, and this eye here. Now I'm going to inject a syringe of fluid into here too to match it. So I'd like to brag that I'm very brave, but it really isn't that uncomfortable.
It's not?
No. And it's always good for a doctor to have to practice what he preaches. Now as I'm going more superficially, I'm using a lighter filler. The first filler was a collagen. This is a hyaluronic acid. That doesn't mean it burns. It's just like the fluid in joints. And it will actually attract moisture to the tissue. So over time it continues to improve the look. I don't suggest people buy filler and do this on their own though. So this is stage 1. Now I'm going to add filler here. Okay. Now we're going to inject a little Botox. That's it for the Botox. And now we're going to do a chemical peel. Now normally when I do a patient, they don't go bruised like this, but because I'm injecting myself and I have to adjust for the fact that I can only angle myself so many different ways. Angling my arm to get my injections, I had to go in at different approaches. Whereas if I were from the outside working on the patient, it would be different. It would be easier. Now I'm applying the peel. This is basically an astringent right now, just to clean the skin. This peel will get rid of little, tighten pores, tighten the fine lines and wrinkles. And people who have melasma, brown spots in their skin, it'll eradicate those. If it doesn't do it completely, they can always get a second peel. The downtime is minimal. I'll look a little pink tonight and tomorrow, and then a little suntan on the second full day after the peel. This is Tuesday, so that'll be Thursday, and then Friday and Saturday I'll actually peel, and by Sunday I'll look great. This is the stronger peel, and once I apply this I'll feel some burning, and then I'm going to use a blow dryer set to cool to deal with the burning sensation. This is just to protect the area from the peel, because these are little crevices that you don't want to have flakiness. It would be a little uncomfortable for the patient. And now for the peel. So now I feel a little tingling, nothing terrible. It's a little puffy here right now, but that's because of all the trauma of the injections themselves. It should really look nice in a couple of days. Now I have this peel on for about 2 minutes now, and I can feel a little bit of a burning sensation, nothing much, but if somebody's a little sensitive, just a little cool breeze is fine. And again, I'll be a little pink tonight, maybe. Tomorrow I'll look like I had a sunburn. That'll be Wednesday. Thursday I'll be suntan. Friday and Saturday I will peel, and it will come off in, I'm not saying your face is coming off, but it'll be like if you had a bad sunburn and you were peeling. And by Sunday I should look great. Hi, I'm Dr. Fretta again, and this is 1 week after I did the injections in my face. Alright, so this is where I added my filler, here and here, and in my temples where I was beginning to shallow out, and then I did a little bit of Botox above and a chemical peel to smooth out the face and eliminate some fine lines and wrinkles. Last week's procedure may have seemed a little macabre to people seeing me inject myself, but it really isn't a painful procedure to undergo, and it's far easier for a patient to receive these injections than for me to, quote, inflict them upon myself. However, the bruising was minimal. I worked the next day. I was showing off my face to my patients, and you get a little bit of puffiness for 2 days after the injections, and then that diminishes. I was out to dinner Friday night that same week. As far as Botox goes, Botox is of no consequence. You really don't bruise unless, unfortunately, the physician pinches a little blood vessel and then you get a black and blue. But that also diminishes in 2 to 4 days. And the chemical peel, I was really happy about. For the first 2 days, the face felt a little tight, and then on the 3rd and 4th day, you get a little flakiness. Night of the 4th day into the 5th day, most of the flaky skin comes off, and you may have a little flakiness continue for a few more days, but nothing of great consequence. It's not really noticeable to anybody else unless you're wearing a black blouse, shirt, or sweater, where people may think you have dandruff. But again, it was a painless situation, and it gives a nice smooth result. I love showing what we do, and I love showing what we do on me. Again, I'm 59 years old now, and I think it helps me keep my youthful look.